Good morning, everybody. Welcome to our Super Talk Tuesday special edition. We are so glad that you're with us here on October 29th for a really great time with some great presenters. And we thank you for joining us. If you are not a regular Talk Tuesday participant and you're just joining us for today, we do welcome you. It's a really great space to come together, share ideas, and really gain some new insight and information. Just a little reminder, if you have not changed your Zoom name to your full name, first name, last name, we're going to ask that you do so for attendance purposes, and you can do it by, there's usually three dots above your Zoom box. You could click that to rename yourself. If you need a little help with that, you could just message Holly Ryan privately, and she could assist you with that piece. But we want to make sure that we capture everybody that's here today because we will be sending out the PowerPoint and the information along with the recording, the link to the recording. So today's agenda, we have a very packed agenda today. So that's why we really want to get going and so we can really get to our information. I am Christine Killiland. I am consultant at CERC. I welcome you here. I am here with my colleagues, Anne-Marie Cardisco and Holly Ryan. We are also here with our CSTE partners and colleagues. We have joining us today Chloe Ann Bobrowski, who's the Education Manager for School Health and Student Support. And she's going to give us a little bit of information on student health and safety. Also here with Carrie Sullivan-Custer and Jay Brown. Joining us today is the Connecticut Department of Public Health team. We have Dr. Amanda Durante, Kathy Kudish, we have Deepa Mavani, Lynn Sosa, and Kristen Soto. Thank you for joining us. And at the end, we're going to enjoy a district presentation from Suzanne Lavassar on strategies for health office to support school attendance. We are definitely looking forward to hearing from the district with some great information about what that looks like in the district itself. I will wrap up a little bit in the end, just with those few reminders before you go, but we want to get going right away to give everybody the right amount of time. So just quickly, our Superintendent's Digest, which is full of great information for your schools and districts. It has attendance information, but has other information as well from the State Department of Education. The QR code is to the right of your screen along with the link. So if anything, these are just the newest things that were on Superintendent's Digest for the last few weeks, but they put on new stuff every week. So I would definitely really say check it out. Some great resources there, or just some announcements that are interesting. And Kari is with us today, but I will quickly be just sharing these slides for you because, again, we want to get right to our presenters. So this is attendance results September. This is from the last 6 years to really look, thinking about what September 2024 looks like, knowing that we have gone down. We're still working hard. We're still making progress, but seeing where we were at, especially in 2021 when we were increasing to 2020, 21, 22 when we were at a height, and how we now within these last few years are decreasing and going down. It means our efforts are really paying off. Even our high needs population has decreased. Even all students has as a whole. So we really want to keep the effort. We really want to do, though, consider, how was attendance in your district and school for the past month? What did that look like? Did you think, or did you feel you had a strong start to your year? What does your numbers look like in your data tell us? So what are even some strategies that worked? What are some things that you feel that you did well? And when you think about these things, think of a scale 1 to 5, 1 being the best and 5 the lowest. But these are even great conversations you could have with your data team, looking at this, thinking about the start of your year and really thinking about, celebrating those accomplishments and improvements, looking at the challenges and thinking about, what you could do next. And I want to share this with you as well. This is from EdSite, the secure, oops, sorry. But it's behind the numbers, EdSite secure attendance and reports. So just looking at this graph, have you seen the new attendance reports at all from EdSite? And do you want to learn more about how these new reports enhance access to important data? So the CSDE released a new set of reports in EdSite Secure, the yearly attendance report and the monthly attendance report. So the yearly attendance report shows attendance data collected in June PSIS. The monthly attendance report shows data collected during the monthly attendance collections. So these dashboards provide authorized users visualizations that mirror the graphs available on the public attendance reports on EdSite. Secure users can view student level data and disaggregate chronic absence, average daily attendance, and truancy rates by student characteristics such as race, gender, English learner, multilingual learner, students with disabilities, and high need status. So join this session to learn more about how these reports enhance access to important data. So the webinar that's listed with the session is, you could register there for this webinar, is hosted by the Performance Office. That is November 14th at 1 p.m. So this is something that I think it would be really beneficial to a lot of schools and districts. Okay, moving along. I don't know if Aristide Hill is here and Joe Hawk, but right now they want to talk a little bit about the survey. There's Joe Hawk, great, from the Governor's Prevention Partnership. So go right ahead, Joe.
Okay, good morning, everyone. It's a pleasure to be able to talk to you a little bit this morning. If you could go back to the power, okay, the Governor's Prevention Partnership is working and collaborating with the state Department of Education to understand how to strengthen school-based mentoring across the state. And we are in the needs sensing or the needs assessment phase right now. I have two activities that are ongoing. One is a survey of superintendents. The first, it was launched last week, I believe on Wednesday of last week, and you would have gotten an email about it. The other are interviews that we're doing with school faculty and staff who may be interested in launching a school-based mentoring program. If you could go to the next slide, Christine, I'd appreciate it. The first is the survey. This is the QR code and the link to get access to the survey. As I said, it was launched last week. Our goal is to have each district respond to the survey so that we can really understand what your needs and interests are related to school-based mentoring, where some of the challenges that you see might be, and how we can tailor our work to help you do this work. We will keep the survey open until November 27th. It will be relaunched weekly until then so that it'll be on top of your mailbox. Again, if you haven't seen it, check your junk mail. Unfortunately, things happen. Things go into spam or junk. And here is the QR code that either the superintendent or whoever is designated could fill it out for your district. We'd really appreciate that. The next slide. The next slide shows we are also doing interviews, particularly with school faculty, administrators, or staff who are interested in starting a new school-based mentoring program or expanding one that already exists, maybe going into a new school. Interviews are very short. They're only about a half an hour. And if you're interested in helping or talking to someone to learn more about it, you can contact my colleague Aristide Hill, who will tell you more about the project and what it has to offer. His email is Aristide, ARISTEDE, @gppct.org. His phone number is 860-757-3579. And thank you again. I know we have a really packed morning, so I'm trying to be as quick as possible. Again, thank you for taking the time to hear about our work.
Great. Thank you so much, Joe. Appreciate that. And we will definitely share the slides out with this information. And we feel free to, Joe, if you have the link, you put it into the chat too, so that they could grab anything that they need from there. But we do thank you. And moving along, I would now like to introduce Chloe Ann Bobrowski, and she'll be talking to us about student health and safety.
Hi, well, good morning, everyone, and welcome to our special edition of Talk Tuesday. I am Clover Browski, and I'm an education manager for school health and student support services. I've also been an RN for 38 years, and I worked as a district school nurse supervisor for about 11 years prior to coming to SDE. I work really closely with Kari, and I am really excited to be here this morning. As mentioned, we've got a full agenda, and I'm very excited to have our team back from the Department of Public Health. You might all remember those Health and Safety Tuesday morning meetings during COVID. DPH was certainly our lifeline back in those dark days, and we are happy to have them back today to update us on circulating viruses and health conditions. After DPH, I'm pleased to introduce Sue Lavasser, who is the District Health Coordinator for Westport Schools and a practicing APRN. She will provide best practice examples that her district has, utilizing their school nurses on attendance teams. So her experience in this area is truly noteworthy. Next slide. So why are we here today talking about health when this is an attendance meeting? So I'd like to provide to you a brief summary of a parent survey on student attendance that was conducted last year. The purpose of this survey was to uncover key contributing factors that lower school attendance across Connecticut. Next slide. So some key questions that were asked. What are some of the reasons you choose to keep your child home from school? Are you more likely to keep your child home now after COVID-19? Are you more concerned about your child attending school in person after COVID-19? What are some reasons your child doesn't want to go to school? And what could help your child be at school more often? Next slide. The survey was actually well responded to. We had almost 5,000 respond in English and almost 500 respond in Spanish. Next slide. So in this slide, we can see that illnesses are the primary reason why children are staying home. Other less common reasons included the lack of interest in the subject matter, mental health concerns, fear and safety concerns, a lack of engagement with peers, and feeling like they don't belong. Next slide. So since illness was the primary reason for keeping students home, the survey asked what types of illnesses. The main reasons respondents are keeping children home were fever, vomiting, a doctor or dentist appointment, and coughs. 17% of the English respondents were also concerned with safety and bullying, and Spanish respondents are significantly more likely to keep children home for the sniffles at 47%. Next slide. So we know that the cold and flu season is upon us, and we will hear more about that in our next presentation from DPH. But I just wanted to take a few minutes to review some of the strategies to stop the spread. Next slide. It's very important to encourage vaccinations. We would like to promote flu and COVID vaccinations and educate parents about their benefits. I encourage school districts to either post online or use Parent Square to share information to parents and families about local health department flu clinics. This is also a reminder that flu shots are mandatory for pre-K students in your schools until their 5th birthday. We also encourage all teachers and staff to get their flu and COVID vaccines to help create a healthier school environment. Next slide. Continue to promote those good hand hygiene practices. Washing your hands with soap and water for 20 seconds, especially before your meals, using the bathroom. Continue to use the hand sanitizer stations if hand washing is unavailable. And remind students to cover their cough or sneeze into their elbow or tissue and put those tissues into the garbage can and then immediately wash their hands. Next slide. You can increase ventilation by opening windows or using your ventilation systems. Schools can consider upgrading HVAC filters or using portable air purifiers, especially in classrooms and smaller spaces. And when feasible, hold classes outside where the air is better and it reduces the risk of virus transmission. Next slide. Again, continue for regular cleaning and disinfection, those high touch areas such as doorknobs, desks, shared electronic devices, and other high contact services, and limit the sharing of school supplies, books, and other items that students frequently touch, or disinfect these items between uses. Next slide. Encouraging staying home when sick. We do want students at school, but we do want to monitor for symptoms of illness in students and staff. And if someone does display symptoms, separate them from others until they go home. We also encourage to continue to test for COVID-19. On October 9th and 10th, districts were sent letters from the Federal Department of Education offering free COVID tests to school districts. And these tests can be used to stock your school health offices, your front offices. You can give to students, you can give to staff, you can give to communities. We also encourage districts, if they do have non-public schools, in their districts, they may consider ordering some extra tests for these schools because only public schools are eligible to create an account in order to order these free COVID-19 tests. And then next slide. These flyers titled "When is Sick Too Sick for School" is available in English and Spanish. It's in the LEAP toolkit. And we've also sent these flyers out to our nurses across the state. I encourage districts to place these on their websites and their school health webpage in order for families to access them. It gives you some really good guidelines on whether or not they should keep their student home or go ahead and send them to school that day. Next slide. And especially during high transmission times, schools could consider encouraging or allowing the use of masks, especially in crowded or poorly ventilated areas. So by implementing these steps, schools can help reduce the spread of respiratory viruses, keeping students healthier and reducing disruptions in learning. So I thank you all for your attention and time. And now I will pass this over to our partners at DPH.
Thanks, Chloe. Bear with me for just a moment while I pull up my slides. Can everybody see the slide deck that I'm sharing? Or somebody who's off mute able to confirm? Thank you. So good afternoon. My name is Kristen Soto, and I'm from the Department of Public Health, and I'm our Respiratory Viral Disease Surveillance Coordinator. Today, we're going to be providing a brief overview of the fall 2024 as well as the winter 2025 outlook for infectious diseases in schools with a focus on respiratory viral diseases. So part of today's presentation is really to make you aware of what data are available so that you can understand what's going on in the community and then ultimately in your schools. And there are several resources available that we wanted to direct you to, both in terms of respiratory viral diseases and disease surveillance overall. The first is that at DPH, we're really excited to have a new infectious disease landing page. This is basically a homepage for all of our infectious disease information in one place. It is a relatively easy to remember URL. It is our main DPH webpage followed by infectious diseases. So it's something that we would recommend bookmarking. We will be sending out these slides, which will include this link. So it will be, again, a great resource for going forward. One thing I wanted to point out is that on the bottom left hand of the slide are the infectious disease top 5 most frequently visited web pages. This can give you a sense of what the hot topics are at the time. And as you can see, respiratory viral diseases is the first link that's available. Clicking on that will take you to our main respiratory viral disease webpage. We also have information on various different topics, as you can see on the right hand of the slide. And then not shown is there's contact information for each of our program areas that make up the ID section. So again, really anybody who you want to get in touch with at DPH in our infectious disease program, the information on how to do so should be on this one web page for your reference. The second page that I wanted to highlight is our respiratory viral disease surveillance page, and I'm actually going to switch over to our live site to show this to you. So what this page shows is all of the respiratory viral disease information that we have available for the season. The first link, which I'll click on in a moment, is our viral disease dashboard, which includes the statistics for the current season. We have data for previous seasons, and then we've also compiled a list of resources from both CDC, internally in DPH, related to both disease surveillance as well as communication that might be of interest to you. So again, this is a great page to keep bookmarked for the viral respiratory disease season. Going into our dashboard now, for those of you who saw this last year, there will be some notable changes that I wanted to highlight. The first thing that we changed was the look of our landing page. So the overall viral respiratory disease season, instead of showing counts of the different conditions, is now showing a graph of our syndromic surveillance data, as well as our hospitalization data for COVID-19, influenza, and RSV. The top graph shows emergency department utilization as a percentage of total visits for the 3 conditions. As you can see, starting off the season, we had a lot of COVID this summer, not as much as we typically see during a winter peak, but definitely a noticeable amount of COVID in our state. And luckily, those numbers appear to be decreasing at this time. And so far, we've had very little flu and RSV, although we expect that to change as the season progresses. Navigating down the left side of the screen are different clickable tabs, which you can drill down for more information from different data sources and for the different pathogens. So for influenza, RSV, and COVID-19, we show total case counts, as well as hospitalizations and deaths attributed to these diseases. For flu, we show a breakdown of circulating strains. As you can see, numbers are pretty low, but starting to pick up a little bit. We have seen some hospitalizations statewide, predominantly affecting older individuals, which is what we expect with flu. And then 2 weeks ago, we did announce our first 2 influenza-associated deaths for the season, one in an infant less than 1 year of age, and one in an individual who was over 90 years of age. For RSV, we have similar information. As you can see, we don't currently have a death tab for RSV, as no respiratory syncytial virus deaths have been reported thus far this season, but additional tabs will be made available as data are available to show. And then again, for COVID-19, we're showing our total number of cases reported, which as you can see are decreasing a little bit. Our COVID hospitalizations, which are remaining relatively steady, and then our COVID-19 deaths by week. As shown on the main page, we have our syndromic data. It's a little bit bigger here and able to drill down and see this information more clearly. And then a new thing that we added for this season is our wastewater data. So in Connecticut, we have 6 wastewater treatment facilities that are sending us data, sending us water samples 2 times per week. And we're able to test that water to look for concentrations of SARS-CoV-2 genetic material, which is the virus that causes COVID-19. The nice thing about this testing mechanism is that it is not dependent on people seeking testing, or if people are getting tested using home tests and we don't receive those results, we're still seeing what people are shedding into their wastewater to give us a pulse of what's going on in the community. The light blue line is showing the average wastewater concentration of nucleic acid, and that's being compared to COVID-19 hospitalizations with the dark blue line. At this time of year, the lines are relatively small and there's a lot of noise. However, as we extend into the season and start to see more fluctuation in COVID-19 activity, This will be another tool that's in our toolbox to be able to monitor what is going on. And what's interesting about wastewater is that it can actually help to predict when we're seeing surges in more severe disease. So in other states and in scientific studies, they've shown that this can be predictive 2 to 6 weeks before a surge in hospitalization occurs. So again, one more tool that's available to us to be able to monitor the outcomes that we anticipate for later this season. Typically, we do have a long-term care facility tab here. We are making some adjustments to that, and so that tab should be back online shortly once that work is finished. And then the last tab that we wanted to highlight is our immunization tab. This shows both the number of vaccines that are being received for COVID-19 as well as influenza over time, as well as broken down by age group. And we do anticipate adding additional information for RSV immunizations in the near future. So in addition to the data that we have on our DPH webpage, the CDC also has a grade respiratory viral disease snapshot page that really gives information about general trends and interprets what the data is showing in a way that can be easily communicated to people in the community. Currently, nationally, overall respiratory illness activity is low, although it is starting to pick up in the southeastern United States, which is often an indicator that we'll soon be seeing increased activity in the Northeast. Drilling down on this webpage, you are able to drill down to individual states or individual counties to get more granular information for your location. And while overall respiratory illness activity remains low, and this is being shown as low for COVID-19, flu, and RSV in terms of emergency department visits, wastewater activity can be an early indicator of disease activity, and seeing moderate COVID-19 as well as high levels of RSV may be an indicator that we'll expect to see increases in these diseases soon. So everybody always asks the epidemiology program to look into their crystal balls and say what the season will look like. We're able to do this based on our experience with previous seasons, as well as looking at data from other parts of the country and other parts of the world, particularly the Southern Hemisphere, where they've already had their RVD season. For this year, we're expecting it to be pretty similar to last year, where there are moderate levels of respiratory viral illness during the late fall and winter months. So not a great season, but also not a very bad season. That being said, we now do have 3 pathogens that we typically see circulating, as I mentioned, influenza, COVID-19, and RSV. And so when these viruses circulate at the same time, it can increase the overall burden of respiratory diseases and put strain on our systems, including our healthcare systems. Typically, we do tend to see these surges right after holidays and right after school breaks because increased time spent indoors, holiday gatherings, and travel all increase opportunities for transmission. So again, the moral of the story is we do expect that this year will be pretty similar to what we experienced last year, but we'll continue to monitor the data and see what actually happens as the season unfolds. There are several core prevention strategies which can help to mitigate the risk of respiratory viral diseases. A lot of these were things that Chloe-Ann had touched on her slides, and those include encouraging students and staff to be up to date with immunizations, focusing on hygiene, especially covering your cough and hand washing, improving ventilation, and then if people are sick, seeking appropriate treatment and then staying home to prevent the spread to others. Additional prevention strategies such as masking, increasing distancing, and testing can also help to reduce the spread of respiratory viral diseases. So in terms of immunization, to drill down a little bit further, influenza and COVID are easy to remember because basically everybody 6 months and older needs both an influenza as well as a COVID-19 shot for this season. There are no mandates for these diseases, with the exception of pre-K students less than 5 requiring a flu shot. But again, this is a prevention strategy that we strongly encourage for all eligible people. It's important to emphasize that we typically use the motto "boo to the flu," meaning that before Halloween is a great time to get these shots, meaning that people should really be thinking about these vaccines now if they haven't already gotten them. If they don't get them by Halloween, it is definitely not too late. Getting a shot at any time is a great idea. But again, we really want to make sure as many people are immunized as possible before these viruses really start circulating in larger numbers in the community. And then the other motto that we focus on is wild to mild. So really the purpose of these vaccines is to prevent severe outcomes, including hospitalizations and deaths. So we don't want people to be dispirited if they get a vaccine and end up getting the flu or end up getting COVID, because really the purpose of these vaccines isn't to necessarily stop all spread, but really to make sure that if you do get the flu or you do get COVID, then you're much less likely to have those severe outcomes and to be able to make a full recovery. For RSV, the algorithm of who should be vaccinated is a little bit more complicated. But in a school setting, really the individuals who we would be focusing on would be staff who would be eligible for these vaccines. So individuals 60 or over who have increased risk of severe RSV due to underlying conditions that put them at increased risk would really be one of the target groups. And then the other would be anybody ages 75 and older. And again, now is really the time for them to be getting these vaccines if they haven't. The other group that you might expect to see amongst your staff would be pregnant women. And again, if they are between 32 and 36 weeks of pregnancy during this fall or winter months, then they would also be encouraged to get RSV vaccine to protect their babies. So in terms of back to school guidance, we're really expecting to see our highest levels of respiratory viral illness picking up in the near future. Typically, this occurs in late fall and winter, and for the past few seasons, we've really seen the biggest uptick in these respiratory viral diseases and the biggest impact starting after the Thanksgiving holiday and then continuing through the winter. One of the most important things to do is to keep kids home when they are sick and to message parents on a school illness policy. The good news is that unlike during the earlier days of the COVID-19 pandemic, when we had different recommendations for different diseases, the recommendations for all respiratory viral diseases are now the same. There is no set number of days to isolate, and it's really based on the symptoms that an individual is experiencing. We would want them to be fever-free for 24 hours without the use of fever-reducing medications. We want them to have a general improvement in symptoms and be well enough to be in school. And then we would also encourage individuals to consider masking upon their return from an illness to further limit transmission in the school setting, as well as in the community in general. In terms of reporting guidance, individual cases of respiratory illness are not reportable by schools any longer. However, confirmed or suspected outbreaks are reportable by phone to both the local health department as well as the state health department upon either recognition or suspicion of an outbreak. This would be for any type of outbreak, but would also be inclusive of COVID-19, influenza, and RSV. One question that we always get is, well, what is an outbreak? When should we be calling? And this is really up to your interpretation. It's anything that is above your baseline level of illness. This can be assessed on a school-wide or in an individual classroom. So oftentimes we've heard that as a rule of thumb, schools have chosen to use maybe 10% illness school-wide or 3 or more cases in a classroom. But again, you know your school settings best, and this is really at your discretion to make those determinations. And we would also encourage you to keep a low barrier of suspicion. So if you're on the fence about whether or not you should be calling, you can call and discuss the situation and see if there are possible mitigation strategies that might prevent the outbreak from growing larger. We're always happy to talk to you and talk through different scenarios if you have any questions or concerns. So we would definitely rather hear from you before things get out of hand as opposed to waiting until you think it's truly an outbreak if you do have those concerns you would like to address. At this time, I'm going to turn it over to Amanda Durante from our immunization program to provide an update from immunizations.
Hi, good morning. Thanks for having me to talk today. I'm going to tell you about pertussis, which is otherwise known as whooping cough, which is a respiratory illness associated with cough of greater than 2 weeks and is associated with coughing fits. There's been a large increase in the number of cases. In all of 2023, there were 11 cases, and up till last Tuesday, there were 238 cases. So that is a big increase. That's an increase that's been seen throughout this part of the country and other parts of the country as well. The 56% of those cases are among adolescents, which I've defined as 10 to 19. And 72% of those have had the recommended Tdap vaccination. We've identified 2 outbreaks this year at high schools. So I want you to, just as Kristen said, vaccination is important to prevent severe disease. For the disease she was talking about, it's also true for pertussis. So we're seeing that a fair bit of the cases have been vaccinated, and we know that immunity wanes over time, but a vaccine is associated with less severe disease and is important. So just to remind you of the schedule, children are recommended to have 4 doses before kindergarten, 1 dose at 4 to 6 months, and Tdap at 11 to 12 years. Students who've been diagnosed with pertussis should remain at home until completion of 5 days of antibiotics. So we've had some indication that that's not always the case, and that can result in some transmission. Students who are exposed to a case and develop coughing should definitely be excluded from school until they see a clinician. And finally, exposed people may get antibiotics to prevent disease. We focus primarily on household contacts and high-risk contacts, by which we mean less than 1 year, under unvaccinated, pregnant women in their 3rd trimester, immune-suppressed people, people with respiratory illness. But we may extend to other close contacts in some situations, such as an outbreak. And discussion about how prophylaxis might be done in the context of the school would be discussed between nurses and local. Thanks very much. So Deepa.
Yeah, next slide, Kristen.
Sorry, I'm trying to advance. It was not going. Okay, there you go.
Thanks. And I think this is the last one. Good morning, everyone. It's everyone's favorite time of year again. It's this annual school immunization survey time. We sent out email communications to all the school nurses and nurse supervisors last week on October 21st. So take a look in your inbox, your spam folders. Hopefully you've gotten that. If not, definitely reach out to dph.immunizations@ct.gov and we will get you, we'll forward you that email and the cover letter. It should look very similar to previous years. We've just updated a little bit of the interface. And also last week, a couple of the immunization staff were at the school or the new school nurse orientation, and they were able to review it in a little bit more detail with a lot of the newer nurses, had a lot of good questions, and were able to provide that training for them as well. We are asking for everyone to complete that by November 21st. And if you have any needs for an extension or any specific circumstances, please reach out. And last but not least, the school survey data for last year, the 2023-2024 year, will be posted on our website soon. So keep an eye out for that as well. And I believe that's all we have.
Yes, that's it for our DPH update. Chloe Ann, were you going to introduce our next speaker?
Yes, I'd be happy to. Our next speaker is Sue Lavasser. As I previously mentioned in the opening remarks, Sue is a district health coordinator for Westport Schools, and she is a practicing APRN. And she's going to provide best practice examples for her that her district has utilizing their school nurses on attendance tapes. So thank you very much.
Good morning, everyone. Thanks for having me here today. And I think a lot of people on this call probably already do a lot of this, but I think as we start the school year, it serves as good reminders of how we are leaders in our schools on school health, and we should be, front and center on a lot of these issues involving attendance. You can advance the slide. So one way to look at this is through our tiered interventions like we do for other things in education. Tier 1 being some of the things that our district can do to kind of, do for across the board. So everyone is on the same page and everyone knows how important attendance is. And I think all students, staff, parents should always know and understand the requirements for attendance. I've met with a lot of families that we've had attendance issues with their students, and they really have never even understood that coming to school is a law and it's not a choice. So, I mean, sometimes it can be as basic as that. Using every opportunity to share this information with all families, reviewed, reinforced, back to school night, other opportunities, parent-teacher conference days. I'm a big proponent of the nurse being part of those programs, even if it is on the school night, having a table, having to answer questions or give information on some of the things we learned today about illnesses, and having a face there with the whole school team. Parent education programs, positive interventions. So many families suffer with school refusal, and helpful hints to get their kids back in school can be part of that too. Important to have designated monitors of attendance. I'm sure it's happened to all of us where we get a call from an assistant principal or from somebody to say, this student has been out 42 days, and it's March. And by now, they've missed so much school, and really putting those interventions in place don't work as well. So really being on top of it. In my district, we have some health assistants that are able to do the attendance out of the nurse's office, and kind of be there when we've gone over that that magic number of 9 days, and really start to get the team involved and put some of those supports in place very early on. And again, the health office and the nurse's role is essential in this. You can advance the slide. So some tier 2 interventions are things that we can do to kind of target those kids who we've identified are having a problem with attendance. And again, the goal, getting there early. Home visits can be done, certainly with parent permission. We don't just show up at the house, but it can be done by a school nurse or with support staff, PPS staff, social workers, and going to help the family to get that student into school and provide education in the school setting. Support for parents through the health office, a simple phone call. We noticed that your student has been out. How can we help? What's going on? How can we talk through this? I also advocate for having communication with their outside health provider, whether it's a psychiatrist or a therapist. So often these students aren't coming to school, and maybe it's because of asthma, or maybe it's because of another medical or mental health condition. And when we reach out to the outside provider, they have no idea that this student has missed this amount of school. And this can be very effective for them reaching back out to the family and providing education or additional supports as needed. If we have a student missing a lot of school, collaborating with the other school in your district, with a sibling might be there, and seeing if they're seeing the same thing is a good strategy. Getting the team together, an attendance team that can all get around the table and say what is going on here. And this is where the school nurse is so valuable to say, well, I know the student was out with a concussion for 3 days, and I know they had the flu for 4 days, and this might be okay. We can deal with this, and attendance is approving. But getting that whole team together so we do not work in silos, and all of a sudden the student has so many absences that they're really behind. School-based counseling is something we can do, getting them involved early, doing record reviews. So often we'll have a student who has having attendance issues, who has missed a lot of school, and we kind of go back and look historically. And I can't tell you how many times we find that these same students that are struggling in middle school and high school really had attendance problems all the way back to kindergarten and elementary school that weren't aggressively addressed, and thus it has just continued to get worse. School connectedness, I was really interested in to see the survey that was presented earlier in this presentation about the reasons. I thought that was very, very telling and helpful. And school connectedness, we all know students want to come to school when they have friends there, when they feel connected to the things going on in school, when they're involved in activities. So I think that's really important to identify these students that maybe don't have school connectedness and getting the team to rally around them as well. And then you can do the slide, tier 3. Oh, I'm sorry, one more thing, involving the medical advisor. So another thing that's I have found very helpful over the years is when you have these students with a lot of missed school, kind of vague complaints, and they might have a lot of medical notes to say, please excuse. And the notes are piling up, but it's not necessarily a reason that we don't address the chronic absenteeism. And getting the medical advisor involved to speak to the outside healthcare provider as well. I think sometimes physician to physician or healthcare provider to healthcare provider, they seem to sometimes get better results than we do. So involving them early and helping work as a team with the outside provider. And it's also important to monitor early dismissals and tardies as well. And you can advance the slide, thanks. So tier 3, this is when it gets a little more intensive, and we've tried so many of these supports and nothing seems to be working. You might have to do a family with service needs. You could get your local juvenile review board involved with parent permission. We usually go to PPT, even if it's just an attendance issue and it hasn't that much affected academics. We will go to PPT to try to offer supports and figure out the reasons for what's going on. Some of our students with school avoidance, we might have to offer modified days, flexible scheduling, meet the family and the student halfway and try to build upon that. And students sometimes with high levels of anxiety who are not coming to school, the further they get behind, the more anxious they get, and the more they're out, the more they stay out. I think we all note that to be true. So at the secondary level, giving them a plan for credit recovery so some of that anxiety can come down, and getting them at least into the building in some capacity to stop. And these complex cases obviously should have a case manager. Next slide, please. So this is, I apologize if this prints too low, but just a review of the nurse's role in attendance. So the 1 through 9 absences will be excused for any reason, as long as we have the parent or guardian approves the absence and communicates with the school. But for 10 absences above, we have a higher level of compliance or, steps that the family has to go through. So I'm not going to talk about all of these because they're right here, and this is just a review, but I want to talk about student illness. So for student illness, they have to provide documentation, a note to deemed excused by an appropriate licensed medical professional. So school nurses are appropriately licensed medical professionals. So we are the school nurse. So I think it's important to know this is when you know your families, you know your student. For an example I used before, we know the student has been out with some legitimate medical things that has kept them out of school. They're over the 9, and they might call the health office and say, my student has vomited the last couple of days and they're going to be over the 9. And this would not be a case where the student necessarily has to go to the healthcare provider just to write a note. And those offices, trust me, do not want to write, notes for everything. So this is when a school nurse talking to the family, giving advice about when they should be coming back to school, and sharing this information with the team that yes, they're above the 9, but these are going to be excused absences because we are working with the family. So I just wanted to highlight that and the important role of the school nurse there. Next slide. Can advance the slide. Thanks. So, oops, one too many. Okay, so the last slide here is health guidance for going to school and exclusion policies. And we saw some today, some really excellent guidelines, and certainly some very stringent ones that are so appropriate with things like pertussis that we know we are all seeing. But I would also like to talk to everybody about using flexibility and an individualized approach that incorporates clinical judgment. So while these exclusion things are very good, there are many cases where this might fall into the gray area. And again, the role of the school nurse and talking to these families about when their child can return and really what makes sense based on this individual case, I think is important. And inclusion criteria change. I have the AAP book. It's not completely in line with what we have used in the past. Strep throat now has gone from 24 hours to 12 hours, and changes, keep coming. So I would advocate for looking at what's out there, the evidence-based data, talking to your medical advisor, your health district, and constantly looking at this so it's up to date, and again, using an individualized approach. And most children with mild symptoms, such as a cold or a rash without a fever, can come to school. So that's the good news, and talking parents through that as well. So that's all I have for you today. I'm happy to stick around and answer questions. Thank you.
Great. Thank you so much, Suzanne. That was fantastic. And thank you all. We do want to open it up if anybody has any questions or things that they would like to ask. We have our presenters here and Sue. And please feel free. I mean, I know we have some questions going into the chat, and thanks for those that are responding. But if you'd like to ask anything, we kind of want to give a little bit time now to do so. You can either put your hand up or just unmute. I'll stop sharing for just right now.
Maybe some of my colleagues can speak to this. I've just seen it in a lot of resources. Again, I have the American Academy of Pediatric book that it's specifically written for daycare and school, and has a lot of guidelines in it. And I think the latest on that was 12 hours after the student receives antibiotics. Of course, that's assuming that the student is well and fever-free. So again, things come into this, but that's where I know that information is.
It looks like we do have some other questions kind of coming into the chat. One of them, if someone has had COVID within the last 3 months, do you still recommend they get a vaccine this fall? So I don't know if DPH is on. Oh, go ahead, Amanda.
Amanda, do you want to take this? Or yeah, go ahead, Dee.
All right. I'll just jump in. Yeah. So yes, they can wait a period, and I was confirming, I believe it is 3 months, but they can get the vaccine as soon as possible. There's no contraindication. They just don't want to be actively sick, so feverish, any of that, when getting the immunization, but they can get it after they've recovered.
Great. Thank you so much for that.
You're welcome.
Any other questions? If not, I will finalize it with our closing. Okay. We do thank everybody for joining. Oh, Kari, go right ahead. I see your hand up.
Okay, great. Thank you. I do know from our data that attendance does decline in November, in December, and sometimes in January. And just want to encourage our local health departments and our school districts to work together to promote those positive messaging to family and to change perceptions about when to come to school and when to stay home. There's lots of resources in the chat, and I just want to thank everyone for coming today. Thank you.
Fantastic. No, we do thank everybody. So we wanted to close up with our finishing slides. For those that are just attendees today, we do have regular Talk Tuesdays. Here is our schedule for the rest of the 24-25 school year. You are more than welcome to come and join us at any time. They're not mandatory. You don't have to be here, although we'd love to have you in the space. But we do record them, send out the PowerPoint along with the link to the Talk Tuesday website, so you could watch the recordings and access it there. But you do have to register in order to get the Zoom link and all the information. So there is a registration link right here embedded in the PowerPoint. But if Holly could also drop the registration link in the chat box, that would be fantastic. We'd love for you to join us, or if you have a colleague that might be interested in our Talk Tuesday series, it's really a great place to be. For those that are our regular Talk Tuesday participants, you did receive a new Zoom link moving forward. This is the Zoom link we are using. We had to go to a bigger space, which is great because so much great interest in our Talk Tuesdays. So please always reference the new link. The old link is going to be eventually deleted within time. So this is the new space that we'll be in. So for those that would like to join us, please register for Talk Tuesdays so we get your information. And if you need to contact any of us for any reason, here are our emails here. We will provide contact information if our presenters would like to share it in the email when we send it out in case you have any questions. But for right now, this is our information. Again, we thank you for joining us and being part of this special session. I hope you got as much valuable information as I did and learned a lot of new things, not only with most recent information from DPH and from CLO, but also, Sue, thank you for what the district is doing and their lens, especially into those tiers, which are valuable for making progress. So we thank you again. Have a wonderful day, everybody.